If you lose all your hair before you're 24.
Hello, welcome to our Q&A session. I'll be addressing a question that got sent to me. It says, I recently had a hair transplant. Why is my scalp breaking out? To paint a picture of what is being asked, the person has had a transplant typically at about 3 months. This person is experiencing some pimples, what looks like pimples, in the grafted area. That's folliculitis, inflammation of the hair follicle group, or it could also just be ingrown hair, whereby the hair is growing into the skin and causing an inflammation. Either way, the reason this is happening is because you have new hair that is trying to grow. It's germinating just like gardening. You plant a seed and the seed is germinating and it's trying to poke through to the surface. And that's what's happening with the hair. When you do a hair transplant, you've transplanted the stem cells of the transplant. After a latency period of about 3 months, the stem cells will start producing new hair. And when that new hair is formed, it tries to break through to the surface. And when it does that, sometimes it will encounter opposition. The skin layer might present some opposition. And when that happens, there is an irritation and there's an inflammation, and that forms a pimple. Sometimes the resistance is strong enough that the hair cannot break through. Instead, it will actually just crawl in on itself and form what is called an ingrown hair. The net result again is that pimply appearance of inflammation. You may even have some pus, and hence this concern. Well, in a way of looking at it, it's good news because it shows that you're beginning to have some growth. Obviously, you don't like the pimples and you don't like the ingrown hair, you don't like the symptoms, pus, and that's worrisome. Now, if you just have a couple of them, typically that's nothing, it will come and go. The advice is usually to, of course, contact your transplant doctor to examine it and decide if there is need to treat it. Sometimes there is need to intervene by surgically by removing them or by giving you medications, but that is not a scope for discussion here. That will differ. You should refer that to your transplant doctor, who should examine you and treat accordingly. But breaking out in the area of transplant, 3.5 months, 3 months, is usually an indication of growth activity. I hope this addresses the questions adequately. Thank you very much.
Pick up the phone, make an appointment for you. Pick up the phone, make an appointment for you. Pick up the phone, make an appointment for you.